You know, we're absolutely drowning in information these days, aren't we? Headlines everywhere. Everyone wants your attention. It's tough to figure out what actually matters.
It really is.
And that's why we do this deep dive, right? To cut through that static, pull out the really crucial stuff from the sources you send us, and hopefully make some sense of it.
Exactly.
So today, we're tackling a global health issue that honestly doesn't always get the spotlight it deserves, despite its massive impact.
And our job today is specifically to unpack India's approach to tackling diarrheal diseases. It's quite comprehensive. We'll pull out some maybe surprising facts and definitely some effective strategies, all from the material we've got.
Sounds simple, maybe. Diarrhea.
Yeah, on the surface. But the solutions, they're really multi-layered. Quite insightful, actually. A real lesson in public health, I'd say.
Totally agree. Think about it. A health crisis killing hundreds of thousands of kids every year, but somehow kind of invisible to many. That was the reality India was staring down. But the really fascinating part is how they built this program step by step to not just react, but to actually change things. So yeah, our topic, India's National Diarrheal Disease Control Program. It's kind of a blueprint offering lessons way beyond India. Okay, let's unpack this. So to really get a handle on what India achieved, let's start with the scale of the problem. Just how bad were diarrheal diseases globally, especially for kids?
Pretty bad. Stark, really. Diarrheal diseases are a huge cause of sickness and death, particularly for children under 5. Globally, it's actually the third leading cause of death for kids aged 1 to 59 months.
Third leading cause.
And the real kicker, it's largely preventable and treatable.
That's just staggering for something we know how to handle.
Yeah.
So definition-wise, what are we actually talking about when we say diarrhea based on our sources?
Okay, so technically the sources define it as the passage of 3 or more loose or liquid stools per day. But crucially, it's less about the number and more about a recent change in consistency and character. That's the key.
Right, not just frequency.
Exactly. We're not talking about babies who are breastfed, having naturally looser stools, or someone just going more often, but it's formed. It's about that sudden, worrying shift to loose or liquid.
Got it. And there are different types, right? The sources mentioned 3 clinical forms.
Yes. There's acute watery diarrhea. This can last hours or days, and importantly, includes cholera. Then there's acute bloody diarrhea, which is dysentery. And finally, persistent diarrhea. That's when an episode drags on for 14 days or more.
Okay. And the human cost, globally and in India.
The numbers are, frankly, heartbreaking. Globally, we're looking at nearly 480,000 children under 5 dying each year from diarrhea, plus another 50,000 or so aged 5 to 9. That's WHO data from 2022.
Unbelievable.
And in India specifically, it was causing around 9% of all deaths in children under 5. Think about the sheer volume of illness, too. Something like 1.7 billion cases of childhood diarrhea happen globally every single year.
1.7 billion cases. And the sources link this high incidence to things like unsafe water, poor sanitation, low literacy, malnutrition. It sounds like this tangled web of problems.
It absolutely is. They're all interconnected.
So how did India even start to tackle something that complex, especially when it's so widespread?
That's the interesting part. India recognized this complexity quite early on. They knew treating symptoms wasn't enough. You had to go after the root causes, that whole web you mentioned.
Right.
And that's why the National Diarrheal Disease Control Program, the NDDCP, was launched. This was way back in 1978 under the Ministry of Health and Family Welfare. It wasn't just a standalone thing. It was a key piece of their bigger child survival strategy.
So integrated from the start.
Yeah.
What were its main goals, the core objectives?
They were pretty clear. First, slash the rates of illness and death from diarrhea, especially in under 5s. Second, push for early, effective treatment using ORS, oral rehydration solution, and Zinc. Simple tools, big impact. And third, really importantly, boost community awareness. Get people practicing better hygiene. It was a multi-pronged attack, really.
Let's get into those interventions. You mentioned oral rehydration therapy, ORT. Sounds like this was the absolute bedrock of their treatment plan.
It really was. ORT is the cornerstone. And it's amazing, right? A simple mix, clean water, salt, sugar, costs almost nothing. And it works incredibly well. It gets absorbed in the small intestine, replaces those lost fluids and electrolytes. Simple, effective science.
And the sources mentioned an improvement, low osmolarity ORS.
Exactly. Following WHO recommendations, India adopted this low osmolarity version. Basically, it's slightly reformulated to be even more effective. It helps reduce stool volume better, gets kids rehydrated faster. A smart refinement?
And then there's zinc, given
Okay.
alongside the ORS.
Zinc supplementation, 10 milligrams a day for babies under 6 months, 20 milligrams for older kids up to 5 years, and crucially, for a full 14-day.
14 days. Why so long?
Because zinc does more than just help in the moment. The sources say it cuts the duration of the diarrhea episode by about 25% and reduces stool volume by around 30%, but it also helps the gut lining heal and boosts the child's immunity against future episodes.
Ah, so it's treatment and a bit of prevention for the near future.
Exactly. It's a longer-term investment in the child's health.
And to get these treatments out there, they set up ORS zinc corners. What are those exactly?
Think of them as little community hubs. You find them in health subcenters, Anganwadi centers, those are community childcare centers, primary health centers, even temporary ones during big campaigns.
And they just give out supplies.
Supplies, yes, the ORS sachets, the zinc tablets, but also, crucially, information. IEC materials, information, education, communication, so families learn how to use them correctly. It's about access and knowledge.
Makes sense.
And building on that, there's the IDCF, the Intensified Diarrhea Control Fortnight. It started in 2014, happens every year now. It's a massive push.
Like a yearly campaign blitz.
Pretty much. The goal is to mobilize everyone. Boost ORS and zinc coverage dramatically, get frontline workers, the ASHAs, ANMs, AWWs really involved and visible in the community.
Okay, so what kind of things happen during this fortnight?
It's very practical, very hands-on. Health workers do household visits. They distribute ORS packets. They actually show parents how to mix the ORS solution correctly. Plus, lots of counseling on hand washing, safe water, the basics.
So boots on the ground, direct education.
Absolutely. And all this activity is tracked. There's surveillance and reporting through their health information systems like HMIS and IDSP. This helps spot outbreaks early, monitor trends like the seasonal peaks often seen around the monsoons.
Right, so they can be proactive. Okay, we've talked treatment, getting ORS and zinc out there, but the best cure is prevention, right?
Yeah.
What did India do on that front? What actually causes diarrhea?
That's the next crucial layer. The causes are quite diverse. You've got viruses. Rotavirus is a really big one, the most common cause globally. Norovirus, too. Then bacteria like E. coli, Vibrio cholerae, the one that causes cholera, Shigella, Salmonella.
A whole rogues gallery.
Exactly. And even protozoa, tiny parasites like Giardia, Entamoeba histolytica. This wide range of bugs is why a single magic bullet wasn't going to work. The approach had to be broad.
Which brings us to vaccines. You mentioned rotavirus as a major cause. Did vaccination play a role?
A huge role. The rotavirus vaccine was a game changer for prevention. India introduced it into their standard immunization program, the UIP, starting around 2016. Phased rollout, but now it's nationwide.
And how does it work?
It's a live but weakened virus given orally, 3 doses for infants 6, 10, 14 weeks. And the impact? Pretty significant reductions in hospitalizations from severe rotavirus diarrhea. It's like adding armor against a major enemy.
So vaccination is one big prevention pillar. What else? You mentioned that web of issues earlier, water, sanitation.
Yes, the water interventions. Water, sanitation, and hygiene. You absolutely cannot control diarrheal diseases effectively without tackling the environment they thrive in. It's fundamental.
Like fixing the source of the problem, not just mopping the floor.
Exactly. So WASH includes several things. Safe drinking water, that means chlorination, using safe storage containers, maybe point-of-use treatment like boiling, filtering, or using chlorine tablets.
Okay.
Then sanitation. India's Swachh Bharat mission, the Clean India campaign, massively improved toilet access and reduced open defecation. And there's solid evidence linking that directly to lower diarrhea rates. It was a huge public health undertaking.
A cultural shift almost.
In many ways, yes. And the third piece is hand hygiene. Simple soap and water, especially before feeding kids and after using the toilet or cleaning a child. School programs promoting hand washing have also shown real benefits. Connecting all this holistic view is key. Treatment is vital, but WASH stops the cycle.
It all has to work together. And how do you get people to actually do these things, change habits? That sounds like the hardest part.
It often is, and that's where IEC information, education, communication comes in again. It's the human element driving that behavioral change.
What kind of messages are we talking about?
Core messages, repeated often. How to mix and use ORS right. Why you must continue breastfeeding during diarrhea, that's critical. Avoiding antibiotics unless a doctor prescribes them, super important for preventing resistance. And knowing the danger signs like sunken eyes, being unusually lethargic, that you need to get help fast.
So empowering parents with the right knowledge.
Exactly, and confidence to act on it.
How do these messages get out?
Through multiple channels. Community health workers like the ASHAs going door to door,
Yeah.
village health and nutrition days, community gatherings where health services are offered, and bigger media campaigns, radio spots, posters, maybe mobile vans traveling around, meeting people where they are.
And you mentioned the health workers, AHAs, A&Ms, AWWs. They sound absolutely critical to this whole system.
Oh, absolutely indispensable. The AHAs are the real frontline. They distribute the ORS and Zinc, do the counseling, they're the eyes and ears for surveillance. Then the A&Ms, auxiliary nurse midwives, and AWWs, Anganwadi workers, handle health education, refer sick kids, manage the ORS stocks at the local level.
And the doctors.
Medical officers supervise things like the IDCF campaigns, manage any outbreaks, and importantly, train the frontline workers. It's a whole coordinated system, a real pyramid of care and support. And recent updates, like from Park's textbook, show this is still evolving. Diarrhea control is now formally integrated under the wider RMNCH plus a HERN umbrella that's reproductive, maternal, newborn, child, and adolescent health. So even more holistic.
Makes sense.
There's also more emphasis on linking up with those WH programs we talked about, making the connection stronger, plus better digital reporting systems and efforts to strengthen the supply chains, always refining.
So looking back, what are the big successes? The achievements?
Well, the headline achievement is definitely a significant drop in deaths from diarrhea among young children. That's huge. But also much better access for communities to ORS and Zinc. People know about it, they can get it.
And the community response?
Improve community-level preparedness. They know what to do, how to respond, especially during those peak seasons or if there's a local outbreak. It's built resilience. The real success isn't just fewer deaths, it's how that happened, empowering communities with simple tools and knowledge. It shows how you can scale public health even with limited resources.
But it can't be perfect, right?
Yeah.
What are the ongoing challenges or gaps the sources point out?
No, definitely still challenges. Supply chains aren't always perfect. Sometimes ORS or Zinc might not be available everywhere consistently. That's a persistent issue.
Okay.
Then there's the inappropriate use of antibiotics, people demanding them or doctors overprescribing them. That fuels antibiotic resistance, which is a massive global problem way beyond diarrhea.
Right, a bigger concern.
Also, in some areas, low literacy levels or entrenched cultural beliefs can still be barriers to using ORT effectively. And underreporting of deaths, especially from rural or remote areas, likely means the official numbers might not capture the full picture.
So sustaining the gains and reaching absolutely everyone remains a challenge.
It does. It raises that key question for any program like this. How do you keep the momentum going? How do you make sure you reach those last, hardest to reach communities?
Wow, what a journey we've taken. From the sheer scale of the problem to the nuts and bolts of the solution. This deep dive really gives you a shortcut to understanding India's incredibly thorough approach to controlling diarrheal disease.
It really does.
And it hammers home that point, doesn't it?
Yeah.
Even problems that seem basic on the surface often need these complex, integrated strategies. Simple tools, yes, but deployed very intelligently.
Absolutely. The key takeaways for me are India's sustained commitment over decades, the power of combining prevention wash-pash vaccines with simple early treatment like ORS and Zinc. And you just cannot overstate the importance of the community health workers and getting the community itself involved.
Real progress towards those global goals for child survival.
Definitely. It shows what's possible when you focus resources and mobilize people effectively.
So as we wrap up, here's something to think about. Building on all this, we've seen how vital basic things like clean water, sanitation, and simple treatments like ORS are. So what other taken-for-granted basics out there might hold similar power to tackle major health inequalities around the world? And crucially, how can we apply the lessons from India's integrated, community-first approach to those challenges?